Alright, so this is Mr. White. He's a 17-year-old male. He was injured in a snowboarding accident 3 weeks prior to this. He has a vertebral fracture and a complete spinal cord injury at T7. He's being discharged in 3 days. So I'm not going to introduce myself. Hi, Mr. White. My name is Emily. I'm going to be your nurse today. So I washed my hands. What's going on? What happened? I heard you got in an accident. So I'd have him explain to me what kind of happened. Just since he's a new patient of mine, he's been here for a while, but just since he's new to me, I would have him explain what had happened, what are his symptoms, everything like that, where his mom is here with him. So I'm gonna go ahead and get some vitals on you, okay, buddy? Listen to his heart. Alright, and I'm gonna get his temperature. Alright, so it looks like he does have a fever, 103.6, blood pressure is 189 over 100, and the heart rate is 56. So, things to consider with a spinal cord injury. Do we anticipate any respiratory weakness? So I would say yes, with a spinal cord injury at T7, that's affecting his abdominal muscles, so which are necessary to breathe. So I would not think that he would need to be on a ventilator or any breathing assistance just because it's not cervical spine, but he might have some weakness with those abdomen muscles. And then possible complications with spinal cord injury, spinal shock, paraplegia, quadriplegia, hypercalcemia, decubitus, pressure ulcers, impaired skin integrity, osteoporosis, bone and bladder function issues, constipation, a bunch of stuff like that. So with his blood pressure being 189 over 100 and his heart rate being 56, I would assume that he is going into autonomic dysreflexia due to the spinal cord injury, with the lack of urine production and bowel movement, means that he's overcompensating for the body with that stimuli. So I'm going to go ahead and do a head-to-toe assessment on him. I'm going to listen to your lungs, buddy, okay? I listen to his back. And his abdomen. Alright, so I'm going to go ahead and palpate his abdomen. Doesn't seem like there's any firmness or it's not round distended. Look at his eyes, equal and reactive, no JVD. Go down to his radial pulses. They're equal, but his pulse is still a little slow. Go down to his legs, check for edema. Pedal pulses, pushes, pulls, equal. Alright. So he has no abdominal or bladder distension. It does look like he's a little, flushed. And so I would assume right now he's going into autonomic dysreflexia. The assessments would be a neuro. So it says he's anxious. I would ask him, like, what makes it worse, what makes it better, what maybe causes it, if there's a certain trigger. Abdominal assessment, I did that, if it's distended. I'd ask when his last bowel movement was, when he last voided. I would look at his skin to see if there's anything going on, any abnormalities or anything like that. So this certified nursing assistant and I roll him over and find that there is a washcloth behind his back. So right now, physiologically wrong with him. He is suffering from spinal cord injury and autonomic dysreflexia. This is caused by the stimulation below the level of the spinal cord injury. It creates an impulse from the sympathetic nervous system and it's typically the lower half that vasoconstricts. So this is something that you need to get medical help for right away. Normally typically an indicator would be a distended bladder and urine, but with that not being a case, it is that washcloth down there. So I would go ahead and let the doctor know about that. This is a medical emergency, so I would make sure that he is aware that this is going on. Medications I would anticipate for the doctor to order would be antihypertensive medications to help lower that blood pressure, beta blockers which vasodilate and decrease that blood pressure, and then maybe a nitrate, which would be nitroglycerin, that helps vasodilate the blood vessels to the heart, so it helps decrease that blood pressure as well. So any of those 3 options. So I'm gonna go let the doctor know what's going on, and I will be right back, okay? See if he wants to order anything for you. Here is Collie. I'll be right back. Alright, Mr. White, so I am back. So the doctor did order some nitroglycerin for you. It's 0.4 milligrams sublingual. So I'll administer that for you. So I check with the MAR first. I check his name, date of birth, wristband. I'm going to check the 5 rights, dose, time, route, patient, drug, and make sure that it's all correct. So 0.4 milligrams sublingual. So I will want to put gloves on because nitroglycerin it vasodilates everything, so it would give you a really bad headache. So I'd take it out and I'd stick it underneath his tongue and just let it dissolve that way. So after that, I'd discard everything, and then I'd come back in 5 minutes and take his blood pressure. So we're gonna pretend 5 minutes went by. I'm here to take your vitals again, okay? Alright, and I'm gonna listen to the heart one more time, okay, buddy? So I listen for a minute as apical pulse. Alright, so it looks like and I take his temperature. Alright, so his temperature is 100.6. His heart rate did go up a little bit to 70, and his blood pressure did decrease with that nitro to 142/90. So as of right now, I would go talk with the CNA to see what we can do to prevent this from reoccurring. I would suggest elevating the head of the bed, preventing constrictions, so TED hose, stockings, any tight-fitting clothing, any tight sheets. Monitor his Foley to make sure there's no kinks, so that urine is, if he has one, it didn't specify, but if he has one, just make sure that's continuing to flow. Monitor INO and blood or bowel movements just to make sure that his GIGU is functioning correctly. I'd make sure that the sheets are free of wrinkles so that he's not laying on a wrinkle, because that could spike the autonomic dysreflexia again. And then I would make sure that we monitor his vitals and his heart rate, his heart rate, his blood pressure, his temperature, just to make sure that blood pressure is staying decreased. If it gets too high, it could cause loss of consciousness. He could have a seizure and even lead to death. So at 17, we don't want that, or at any age, but specifically since he's so young and healthy. And then I'd also want to monitor, maybe rotate him every 2 hours. Obviously we're log grilling him, but to make sure that there's no skin breakdown, decubitus ulcers, or anything like that. So I will go get your teaching instructions. So it looks like he's getting discharged. I will go get those instructions for you, have you read them back to me, and then we'll wait for the doctor's orders and you'll be all set to go, okay? I'll be right back. All right, Mr. White, so the doctor did order that he said you could go home. So I have some stuff here for you. So I have some paperwork that shows you, just in case you forget what we had talked about, what you need to continue to do, what you need to not do. So obviously stay with your medication regimen as planned with the doctor's orders. Don't let your bladder overfill, so when you have the urge to go to the bathroom, make sure you go, just so that it doesn't spike back into where you are right now, because that can happen. Maintain correct body alignment, so straight back when you're sitting up, make sure you're not slumped over. That can sometimes cause it. Prevent bowel and bladder complications, so no signs and symptoms for UTI. Monitor to make sure that you're not constipated, make sure that you're urinating correctly in the right amount. So just make sure that you're more attentive to that than you normally would be. Make sure you're not wearing anything super tight, constricting, and no constricting bracelets, armbands, gloves, anything like that, socks, pants, anything like that can set back off that autonomic dysreflexia. And then take your blood pressure regularly. If it does continue to increase, make sure you let your healthcare professional know. And if you have any symptoms of what you were feeling just recently before we gave you that nitro, make sure that you contact your doctor and let him know, just so that he is aware and he can go from there on whether he thinks you need to be back admitted or what he plans on doing for that. So other than that, I have some paperwork here for you. So this is yours to take home. That's your paperwork, just in case you forget what we had talked about. Other than that, I hope you have a safe recovery and get back to snowboarding, and I will let you guys go. We'll have to wait for the doctor to okay it, but you guys should be okay once he says it's okay. All right. Have a good day.